So B7-H4 is a target that's expressed widely across a lot of tumors. So in this particular study, we looked not at only triple-negative breast cancer, also ER-positive breast cancer, endometrial cancer, ovarian cancer, and a bit of a more rare cancer, adenoid cystic carcinoma. B7-H4 is also a negative prognostic indicator. So high levels of B7-H4 predict that patients aren't going to do well. And so all of that points to a good rationale for targeting this in cancer. So Emi-Le is a B7-H4 antibody-drug conjugate with a proprietary dolasynthen technology. It has a drug-to-antibody ratio, or DAR, of 6. And what's really unique is this is not a topo-1-based ADC. It's an auristatin ADC, and it's a unique payload that we haven't seen before. So it's not an MMAE, it's not an MMAF, it's a unique auristatin payload. So this really is the upper end of the intermediate dose range that we looked at. We kind of had a subclinical dose range, an intermediate dose range, and then a higher dose range. And so 67.4 milligrams per meter squared every 4 weeks was decided on. They're actually looking at an alternate dosing schedule as well, which is a day 1, day 8 loading dose in the 40s, then followed by 80 milligrams per meter squared every 4 weeks as well. And our expansion right now is in triple-negative breast cancer among patients that have had up to 4 prior lines of therapy. Yeah, that's a fantastic question. The antibody-drug conjugates, some of them the target matters and some of them they don't. This is a target where we saw activity really exclusively among those patients that did have B7-H4 expression. TPS cutoff of 70 was used, and among those patients we tested, 40% of those fell in that high B7-H4 bucket. And so that's really where this drug is going to have utility moving forward. What we really saw was an overall response rate of 31% across all different tumor types. What I was uniquely excited about was in the triple-negative breast cohort, 93% of patients had already seen a topo-1 ADC, so this is very real world. Essentially, 86% of them had already seen sacituzumab govitecan, a third of them had already seen trastuzumab deruxtecan, and in fact, a quarter of the patients had already seen both. And so again, with a novel target and a novel payload, we saw in those triple-negative patients a response rate of 23%. Also notably, the response rate in endometrial was 50%, and in adenoid cystic carcinoma, the response rate was 50%, and 5 out of those 9 patients remain ongoing. So again, right now the expansion is in triple-negative breast, but I really could see this drug being looked at in some of the other tumor types that were examined as well.